it's like almost synonymous where people who have either anxiety or depression or other mental health issues, there's sleep issues. And so how much do you dive into, or how much have you started to dive into like the psychological side of things to help treat your patients?
Oh, yeah, it's so true. Again, especially during this pandemic, I think a lot of us have seen it just kind of come out more and more. And I think sleep and um, mental health, it's so intertwined where if you have poor mental health, it can affect your sleep. Poor sleep can worsen your mental health, which affects your sleep, which affects your mental health. So you can definitely say you can get into this really tough spiral. And so I often try to help people kind of sort it out and just say, hey, could this be going on? I am a pulmonologist and a sleep specialist, but I'm not a psychiatrist or a psychologist. So typically, I think I try to see if there's things that are, basically on the surface that I can kind of help people work through. For instance, people like, oh, I have some anxiety or just kind of my mind is racing at night. I might suggest things like, hey, have you tried doing a worry journal before bed? So basically where, you have like, things that you think about and you say, hey, take 10 minutes before you go to bed and just write down all the things that you're kind of thinking about or worried about, and then put it aside and know, okay, I've dealt with it. It's sitting somewhere. I can deal with it later. But I think that's again, much more superficial dealing with anxiety. If someone has true anxiety, true depression, I usually refer them to an expert. So I think my role oftentimes is to see, is it something that I can help you with or something I need to help you get an expert?
Did you learn any of that in school? Was that worry jar like something you learned in school? Because I know for me, one of the things we didn't really go over too much in PT school was just not getting things out of people, but just understanding the psychological perspective people are going through. And was there classes and stuff that you took to help better understand like what they're going through and like how to help with like on a superficial level to refer out?
Yeah, so part of all med school curriculum, and I imagine this is still true, is a psychiatry rotation. So you do get to learn kind of the principles of it, the basics of it. And then just as a pediatric resident, that's also something that we deal with, is like, how do you kind of elicit a history from, a history just means like the story of the patient. How do you kind of get that story from a patient to screen for things that are more mental health disorders or psychiatric issues? So yeah, it's part of our training. But in terms of kind of really the expertise of what to do about them, I admit, I tell my patients, like, you know what, you maybe need someone who really kind of knows what they're doing here. So that's where we, refer out.
And for you, how has your interview skills changed? Did you feel like it's more questions, less questions? Is it, how have you refined your skills? Because getting to the answer that you want, sometimes you run down this rabbit hole, or perhaps there's somebody who just likes to talk a lot. And how have your skills changed? Like, what are some things that you've learned over the past couple of years that helps to change your interview skills?
Oh my gosh, I love that. I still always start with the open-ended, tell me your story, tell me what's going on, tell me why you're here. One of my mentors when I was training just said, it's the patient who has the story, the patient has the history. So I think I really try to let families tell me whatever they need to, especially in pediatrics. Most parents, their intentions are pure. They're coming because they're worried about their kid. They want you to help, right? They've been thinking about their child a lot longer than I have. So I think I like to let them like get out kind of their major concerns. And then I just kind of, there's a few set questions I ask, right? If I'm trying to screen for narcolepsy, I ask about, sleep schedule, I ask about paralysis, I ask about all these different symptoms, right? So I have my set list, but I also, if someone mentions something like, oh, well, he always has to change his sheets because he's drenched in sweat. I'm like, oh, tell me more. How long have you noticed that? So I think I also take clues of what the parents have mentioned. Even sometimes what can seem like a throwaway comments, like parents like, oh, well, this isn't that important. And they'll be surprised. I'm like, well, no. Dive into that a little more. Tell me more about that. So I think my interview style is probably varied a little bit, where I just even allow more time just for space for people to talk, because I've just learned the more time you give people to kind of think about things, the more they'll think about it. And I'm lucky where I'm a specialist, so I actually get more time with my patients. I know it's been really tough, like in our system, our primary care doctors, if you get 15 minutes with a patient, I mean, you don't get that time to just kind of let them, maybe meander through a story. You have to be more directed. And I'm very lucky that I actually have that time and can let people do that.